Hello, everyone, and welcome to Public Health Musings. I'm your host, Dr. Caroline Kingori, a faculty member at Ohio University. I'm excited today to have my colleague and friend, Dr. Joe Bianco, and I'm going to tell you a little bit about him here shortly, but we have been at the same institution for a while now. We will not age ourselves, and we have collaborated on a couple of projects, and I'm so happy to have him on the show today to talk about his work, but also talk about some topics that I'm really interested in, and I think you're going to enjoy yourselves and have a great treat. Dr. Joe Bianco, who is an associate professor in the Department of Social Medicine at Ohio University's Heritage College of Osteopathic Medicine. He's a clinical psychologist with postdoctoral training in integrated behavioral health and primary care, and he focuses on advancing research, medical education, and public awareness of the effects of psychological trauma on health. His research focuses on the effects of childhood adversity on adult health, narrative accounts of trauma and resilience, how traumatic stress in patients affects physician burnout, and designing trauma-informed care training programs for health professionals. He has a background in English, and he's also a literary enthusiast. He approaches his research, teaching, and clinical work from a narrative perspective, and he focuses on how people make sense of traumatic experiences and incorporate them into their life stories. Since 2020, he has served as an associate director of the Barbara Gerald Storytelling Institute for Social Impact at Ohio University. He has, a BA in English and a PhD in clinical psychology. So welcome to the show, Dr. Bianco. I'm so excited you are here today.
Thank you. Thank you for having me. I'm so excited to be here.
So I always ask my guests to tell me, how did they get to this point? So what's your ravishing story, Dr. Bianco?
Well, you know me, Dr. Kingori. We go way back now, and not way back, but way back. And everywhere I've landed has been sort of a combination of really support from a lot of people and good luck or an accident. So, as you talked about, I started off as an English major in college, and that kind of was the culmination of a lifelong love of literature, books. I was the nerdy kid in high school that would just kind of want to escape into a book. And so whether it was Shakespeare or if it was Stephen King or Greek mythology, which remains huge in terms of my everyday life, these are all things that just I loved. And so I went to college and I decided I'm going to study this. And I did. I immersed myself in everything I could involving literature, comparative mythology, all of that. And then I graduated and didn't know what to do at all. So, typical head in a book, no plan. And I was kind of afraid that if I actually went to graduate school for literature, that it would absolutely kill it. Like working at Krispy Kreme, would I not love those donuts anymore if they were part of an obligation and surrounding me all day? I didn't want that, and I didn't really know what I wanted. I was living at the time in New York. I had a very, very tiny apartment, which we called my compartment, because it was so small. It was like just one little room, and I knew I wanted to keep it, so I got a job as I was kind of stalling, figuring out what I was going to do when I grew up. And the job I got was actually at a social services agency, and that agency served as the legal guardian for people with who were court appointed as having mental incapacity, so unable to kind of take care of their own affairs or manage their lives safely due to mental illness. Normally, people like that would be in institutions, but there's no dignity in that. It's an expensive choice, and it's not ideal for the person. And so this agency's job was to serve as the legal guardian for people living in New York who would otherwise be institutionalized, have them live in regular housing throughout the 5 boroughs of New York. And my job as a case manager was to bring money and allowance, coordinate medical appointments, take people to their therapy appointments, serve in the legal settings if they got themselves into trouble, show up in court, explain that, this is not their fault, all sorts of things like that. And in that process, I had the pleasure and the kind of weird sort of unexpected journey of going into about 30 different people's residence houses in New York City, people whose lives were completely interrupted and derailed by the onset of mental illness, usually very severe mental illness. People who couldn't really kind of explain what happened to them or how they got from where they were to where they are now. But I realized in that process of visiting them, hearing the way they saw the world, their worldviews, and then also the way they made sense of a world through the haze of mental illness and through the way that kind of changes how you see the world, hearing their interpretations of their stories, who they thought they were, who they wanted to be, who they once were, who they were now. I just realized that psychology is a story. And so I could have my stories participate in someone else's story. And when I realized that, it was a good 3 years later, so a trinity of gap years, I went back to school because, of course, I didn't take any undergrad classes in psych. So I had to start there and ended up then going into graduate school for clinical psych.
Fascinating. That's a great story. And similar to you, I love just, knowing about people and what makes them tick, which probably why I took psychology in undergrad. And then I found public health, but I still tie that desire to know what motivates people and, just to let the viewers and the audience know that you're the first one who said you do like listening to people's stories. You do like knowing what people are about. And I was like, the psychologist has said it.
Well, I knew I found a kindred soul in you from the start, all about culture. Culture is a story, right? I mean, it's the story of a people and their traditions.
Yes. And look at us today, right? We're dressed in the same colors.
Yeah, dressed in the same colors, acting like grown-ups.
Right.
Podcast.
Yes, indeed. So, when I did your introduction, I said your main area of expertise is in psychological trauma. And, based on what you've told us, I just want you to help us understand, what does that line of expertise entail? What is psychological trauma and health and trauma-informed care?
Sure. Well, it's something that's really near and dear to my heart. I managed to go through childhood, adolescence, and most of my adulthood having never experienced any significant trauma. So I'm privileged and I'm very fortunate in that regard. But what I learned when I came here to Athens from New York, and what I knew from people I worked with in New York, but really understood when I moved to Southeastern Ohio, was that there's a lot of trauma out there, and it's not necessarily the trauma that we think it is. We tend to think of trauma as a terrible event, like a single occurrence, like the World Trade Center or the pandemic, right? An unfolding trauma on many levels. But we don't realize that there's other forms of trauma that both the people who suffer from it and the people who take care of them are not well equipped to see. And that trauma is sort of the chronic, everyday life trauma that's actually still intense, not just stress, but is intense, cumulative, affects you day in and day out. So there may not be a single event, for example, like racism, or having an invalidating environment, or in childhood, having chronic neglect in your household, right? Neglect is the absence of an event. It's something that should have happened but didn't, and yet it can still register as a form of trauma, but one that's very hard to point your finger at any event or any single point in time. So in addition to the post-traumatic stress disorder model of trauma, which is the event-based trauma, you have traumatic stress that accumulates over time, and it comes from the outside world, and it sort of affects us physiologically, psychologically. And what I realized when I came here, I was doing therapy in the middle of New York City. So I thought I saw everything. I was like, nothing will surprise me at all. And then I came here and started a postdoc in integrated behavioral health and primary care. So I was working in our residency clinic here, and I was working with providing free therapy with members of the community, and particularly uninsured people, people with very little access to healthcare their entire lives, people who have received a lot of life's misfortunes. And I found that they would talk a lot, very matter-of-factly, about just all the foster care homes that they were in, or how many losses they've sustained in life, or just all of these different sort of things that seem to add up to trauma, but weren't recognized as that clinically. And a lot of that happened in childhood. And so the big thing that I think is important to take away about traumatic stress and trauma in general is that trauma shapes us in different ways. And when it occurs early in life, it shapes everything that comes after. It's not something that's a death sentence or something that we can't change throughout our lives, but it kind of it gets woven into who we are as a person. And these subtler forms of trauma that aren't always recognized, like chronic poverty or different forms of household dysfunction, different forms of neglect or abuse or racism, or feeling chronically unsafe in your neighborhood, things like that, they do add up, and they inform a lot of the way patients act and behave or approach their healthcare providers. And it's also very much misunderstood, I think, by healthcare providers and seen as being difficult or quote unquote non-compliant, a word I really hate, when in fact it's often, very often, and much more frequent than we think, an effect of cumulative trauma.
No, it's interesting that you bring up that perspective. And I want us to dig a little deeper into understanding that impact on overall health, right? And the optimal outcomes. So I'll, ask a little bit here about the work that you're doing with stories and things of that nature. And in your podcast with Dr. Lynn Harder, called Defining Moments, you discuss stories about living well in the midst of inescapable illness, suffering, and hardship. And when you think about just that impact of psychological trauma on health, what is it that you've learned and, over your training and the patients you've seen regarding living an optimal life despite life's challenges?
Yeah, I have to say I'm so honored to be part of the Defining Moments podcast, because it's put me in conversation with people who are living examples that trauma is not a death sentence, and that trauma, which is the ultimate sort of lack of agency, right? Trauma happens to a person. For example, on the podcast, I've talked to a patient safety scholar who at the age of 38 had a debilitating stroke. And has come out to the other side of that with a renewed appreciation of life. I've spoken with a former student of mine who, right after he graduated, was in a terrible car accident, and at the start of his teaching career and his career in education that he had been working toward all his life, he sustained severe traumatic brain injury and wasn't expected to live. Well, he's here today. He's published a lot since. He's founded a Smith Brain Connections, which is dedicated toward raising awareness and education of traumatic brain injury care for medical providers. So having this window into the way people navigate trauma has really taught me that it's possible to face trauma and to face that lack of choice and that sense of like the world just did something to me that was not my fault, I didn't ask for, and still find independence within that and still find agency. So when life sort of authors the story of this chapter of your story, when a stroke comes and that becomes the focus of your life for the next 2 years, you can still write the next chapter. You can decide what that means and what you're going to do with that and how you want to use that event and make something out of it, which is not to say that you're not traumatized by it, you're not affected, or suddenly in retrospect it's positive, because it's not. There's no beauty in a horrible traumatic brain injury. Like, we can't romanticize trauma. What we can do, though, is acknowledge it and figure out how we can walk beside it and what meaning we want to give it in our lives. And I think the experience I've had in the podcast, the conversations I've been privileged to have with people, have been a really nice template for me and hopefully for listeners on how to take these traumatic and potentially sort of soul-crushing events in life and not succumb to them, and how to take the pen back and start writing the next chapter of your life on your terms within the confines of what happened, how to live well on your terms, not because of what happened, but despite.
I like that. Writing your own story based on the process and the pain and how do you get through that trauma. So something that we see when we look at the transition of, you have this traumatic event and now you're getting through it and you're moving on with life, is grief, right? So that grief, from what it comes from, I wish my life was different. I wish I didn't have this traumatic brain injury. I wish I didn't have this stroke. I'm angry that now I have to change my life. Now I have to write this story, not the way I thought I should. So tell us more about that relationship between, trauma, psychological trauma, and grief. What role does grief play in psychological trauma?
Well, even though you don't have a background in clinical psych, you said it just now better than I could have said it. What you pointed to is that grief is about a loss, right? And most commonly and most often, it's about the loss of a person that was special to us, maybe a pet, or but it's usually attached to someone living who's no longer living. And that's a huge part of grief. But as you pointed out, and I think was really, you said it perfectly, was that trauma is a form of loss, right? And so it entails a certain amount of acknowledgement, of sort of acceptance that this thing that I didn't want happened to me, and it's not going to leave. It's not going anywhere. It involves loss of yourself, a restructuring of your identity in some cases, an understanding of how you can navigate the world now under these circumstances that you didn't want or plan. And it also, it's a mourning and or loss of assumptions that we had. There's the shattered assumptions theory of trauma, which is that traumatic events are traumatic because they violate a unspoken assumption that we had in our lives. Like, for example, my child will outlive me, or, my child will outlive me, or like kids won't get cancer, right? Like, that's what you kind of know could happen, but it does happen. And it happened to my family. And so trauma in a lot of ways is about sort of reconciling the loss of what the world was supposed to be and the promises that we kind of thought, without even realizing it, that the world was offering us. Our assumptions are shattered, and we need to kind of mourn who we were and who we're becoming, and try to make sense of that, just as we do with the loss of a person, a loved one, a pet, And
I'm glad you pointed that out, because often people don't understand that you can experience grief from a dream that didn't come to pass. Because in the past, we've always associated grief with losing a loved one. And so I think the nuance of understanding that, if you didn't graduate, or if you got sick and you had to delay so many other things, so many other dreams that you had, that is part of grieving. And how can someone approach that? What can they do to sort of move between that whole process from the beginning to the end?
Yeah, no, you're absolutely right. These things are all forms of loss. And when you lose parts of yourself, there's no way to kind of publicly mourn that doesn't look strange, right? We don't have a forum for that, but we should. But until that day comes, there are different ways you can. And so, of course, I'm going to say therapy is a great outlet, and there are multiple forms of therapy. But I think that's an obvious answer, right? And it's certainly an obvious answer for trauma. I think, a well-trained trauma therapist would be very important to help people process some of the physiological and sort of existential crises that accompany trauma. But aside from that, there's a lot that in storytelling that provides an answer. Therapy is above all a talking cure, right? That's what Sigmund Freud used to call it. And this idea that telling our story is therapeutic has been supported by a lot of research. It's been supported in different cross-cultural research too. The idea that in telling our story, we're also coming to terms with it. We're reducing shame. We're reconciling who we are with who we were and having an audience for that. And I don't mean everyone has to go into an open mic and start emoting all over the place and exposing their deep, dark secrets. But there's a way in which by holding on to our story and not expressing it, whether it's in writing, in journaling, or telling it to a trusted friend and then starting to feel like you could tell it to more people. But the telling of our story helps us consolidate it. It helps us find meaning. And each telling, we get closer and closer, I think, to both accepting the things that have happened and the things that we've lost about ourselves or our dreams or the people in our lives. But also, it helps us not only just accept that, but it also helps us kind of find meaning and relate to others. There's nothing more therapeutic when you hear someone say, I thought I was the only one, and you were brave enough to tell me your struggles, and then to connect with someone over that, your story touching theirs when you may not even know theirs, but suddenly you have an affinity. So expressive writing, whether you're the only audience or you choose to publish that in some form, just casual conversations with trusted friends or family, and working your way up to telling your story in a larger audience in ways that you feel are appropriate. It means being vulnerable, but when we kind of take the parts of us that are wounded that we're kind of trying to hide and we put them out there, we're doing that in a way that kind of reduces stigma and makes it okay to be fallible human beings, to be grieving, whether it's losing ourselves or others.
And I'm glad you touched on vulnerability. And that's a word that has so much stigma associated with it. And to be able to tell your story, to be able to go through that grieving process, you have to be vulnerable. And so talk to us a little bit about vulnerability and the role it plays in that grieving process, as well as healing and, sort of getting through the psychological trauma.
Sure. I think people who have been through trauma and loss, all of us who have navigated the pandemic, and especially people who've had so many different socioeconomic and just social factors against them before the pandemic, then enter it in a worse state. I think there's vulnerability already there, right? Then when you add loss and you add trauma, you sort of peel away protective layers of a person. And people need to kind of protect themselves first and feel safe before they can then be vulnerable again. No one wants to feel surprised by a trauma. No one wants to be sort of assaulted by life, again. So I think people go through phases where they need to kind of wall off, and that's okay. That's protective. But like any other coping mechanism, if you use it too much, it's no longer a strength. It becomes something that's harmful. And so when people reach a point where they can actually share their story, take those risks, and choose vulnerability as opposed to be vulnerable because life chose it for them. When you choose vulnerability and you take those tentative steps, I think like I said earlier, you start to accept it, but you also just sort of model it for others, and you open up the conversation for other people to be vulnerable. I don't think we can get through this life without expressing or exposing our vulnerabilities. And if people can, they're either really, really walled off, maybe even from themselves, or I don't know, but I would feel sorry for them because, it takes a lot more energy, I think, to suppress what you're experiencing and to hide it and to put on a mask and to be always presenting as perfect than it does to actually every now and then have a breakthrough moment where you're a human being and you're the product of the life we all live,
Yeah. And one thing that has really sort of laid us bare is COVID-19. And it has produced all kinds of emotions and changes and grieving processes, and people didn't even know they were grieving because of all the adjustments we've had to do, including being isolated and being asked to change your life and the way you function. And, when we think about COVID-19 and psychological trauma and mental health, it has that grief that comes from having to change your routine and the grief of loss of loved ones. And I just wanted to get your thoughts on that because the WHO, the World Health Organization, did a report last couple of months ago, and they said that mental health rates have gone up exponentially the last 2-3 years, thanks to COVID-19, especially where people had to stay home. And so is there a difference between the grief and the trauma from just life experiences and the loss of loved ones, or do they sort of intertwine and present themselves in the same way? Does the mind know that it's different, right?
I think the mind knows that there's a difference, and there are differences, right? But as in everything in psychology, right? Things are overlapping, right? There's nothing is just one discrete category. So like you said earlier about loss, there's so many different types of loss. Now, when we lose a person or we lose something very tangible, we have a story to attach to it, right? We have something that we can instantly say to people. I lost my mother, or I lost my child. And even if you don't tell the story, you've immediately been able to put it into a succinct way, a form of communication that someone else is going to understand that this is a pronounced and severe loss. Now, with things like COVID-19 and the pandemic and the way it shaped us, I think we're still discovering how much we've lost of ourselves. And a lot of trauma, post-traumatic stress, occurs after we've had time to process it, not so much during. So I think we're still going to learn how the effects of this sort of absence of our way of life affects us from a trauma point of view. But for now, I think one of the tricky parts is, or maybe it's not tricky, maybe it's actually in a way a good thing. Before COVID-19, before lockdown, before we were in and out of quarantine, before we knew exactly how divided and polarized society was about public health issues, before that, there wasn't really a way to kind of talk about this sort of grief, loss, and kind of quasi-trauma of the absence of something, or the loss of dreams, or the loss of connection to the self. We didn't have a social way of really talking about that. The only hope, I think, offered by something like a global pandemic is the fact that it's one of the few things that every person on this planet has experienced. Not everyone has experienced it equally. Some have been way more affected than others, but the fact that we have a shorthand to say, oh, I'm really messed up from isolation. That wouldn't have flown so well before, right? like, okay, so what happened to you? Well, nothing. That's the problem. Nothing happened. Lots of things didn't happen that should have, right? We now have a way to talk about that, but I think even then, it's still really hard to kind of navigate this murky area that's not well defined of grief, loss, and sort of just even processing what happened in the world. 5.5 million people who were here 3 years ago aren't. That's profound. Whether you know any of them personally or you don't, that's a profound loss for the globe, I think, for humanity, right? And I think we're going to still discover ways to process that, and we're learning how that's going to affect people. We're going to learn and see the longer term effects, but yeah, I think all these things are very real, and I think the key, as I said earlier, is that we need to kind of talk about them more publicly. We need to acknowledge that this is what we're all going for and find ways to connect with each other instead of be divided.
Indeed. And one thing before we start winding down is often what I hear is an expectation that the grieving process or the trauma has a window of time, right? Mm. Oh, it's been 3 years. What are you talking about? 3 years, you're still traumatized about someone passing or COVID? How do we understand trauma and over a time period? How do we understand grieving over a time period? How do we deal with that? And how do we become better at offering our support for folks who are grieving, or even just giving ourselves grace in the grieving process?
I'm so glad you asked that. You raised a really great point that I think intellectually everyone would say, yeah, I know, like loss is huge. It never leaves a person. But then we still do say things like, oh, still? But that was a long time ago. And I think what people really need to understand, and it's my hope that most people will never experience this, but they still need to intellectually understand loss doesn't leave you. It's not always intense as it was, it's not always intense and all consuming as it was like maybe in the beginning of a loss, but it marks you, it stays with you. It never leaves. So when someone says I lost my mother, or someone says I lost a friend that was important to me, I lost a pet, we should honor those things and understand that this person's on a journey, and that journey may kind of be rocky road at different points. It may also be, may also have periods where there's a lull and there's calm, but those losses mark you. And just like it wouldn't be trauma if, it didn't stay with you, if it weren't something extremely memorable. So it's an interesting phenomenon that I think, as a society where we don't have a lot of comfort sitting with something we can't fix. We all want to fix. We want to say that comforting thing, right? We want to tell someone something that's going to help them feel better in that moment. And sometimes the best you can do is to acknowledge that this person's journey is going to be ongoing, that the loss will continue, and that instead of fixing it, you could be there with them and experience the same helplessness, the same sort of inability to change that. So yeah, I think as a society, hopefully we're doing better with that and learning that loss is ongoing. Loss takes many forms, and that fixing it or expecting it to obey any sort of nice little timeline that we have in our heads is completely antiquated thinking. We need to kind of get past that.
Awesome. So to finish up here, just wanted to know, what is the one memorable thing or two in your work or life to date? We've both experienced loss, and people continue experiencing loss of loved ones, and it just really gives you new meaning of life and the importance of being there for those you love, and also taking advantage of the opportunity to be on this earth. So yeah, tell us.
Well, so for me, it is a story of loss, but it's more than that. And it kind of encapsulates everything I love about studying trauma, actually. So this is a more personal experience, but 3 years ago, I lost my son to rhabdomyosarcoma, very unexpectedly developed an aggressive form of cancer, diagnosed at stage 4. It was a shock. And that year was a very traumatic year. It was also a very beautiful year. And there's nothing quite like pediatric cancer to show you some of the darkest, most senseless aspects of human existence. There's no way to make sense of why a child should lose his light before his 13th birthday, right? Why a parent should outlive their child. There's no way to make sense of that. It's dark and it's difficult. At the same time, what makes it equally memorable is not just the tragedy, but the fact that instantly, when the point when he was diagnosed, and consistently throughout his the entire next year of his treatment and the last year of his life, and then beyond that point, we have, as a family, have received more support than I could ever imagine. And I've talked to other people about how it was like this parallel antidote to cancer, right? Like cancer, the problem with that is that your cells multiply out of control until you reach a point where you can no longer live, right? And just as his cancer was multiplying, at the same time, I had friends, I had family, an entire community. I had colleagues where I work, the university, people I didn't know who heard his story reach out to us and provide absolutely invaluable support. And I think that support grew at a rate quicker than his cancer. And it continued long beyond that. And so that's my memorable story. It's a story of the darkest moment of my life, and also the moment where many, many people came together to show us grace and light. And I'm committed to spending the rest of my life paying that forward and doing that for others.
Thank you for sharing that. We saw that happen, and just seeing the strength you got from the community. And it's true, the loss of a child, it's hard. It's hard. But it's good to see you here 3 years later, and being an advocate of more funding and more research. And I wanted to give you the opportunity, if there's anything you want to add towards that advocacy and on this podcast, please feel free.
Oh, thank you. Yeah, no, I would. Thank you. I appreciate that. I just want to point out that there are significant disparities in adult cancer research and pediatric cancer research. And it's not something I ever knew or thought about until it affected me. But every year, only 4% of the federal cancer research budget goes to pediatric cancers, 4%. And these are our children who we're failing, I think, tremendously, because that 4% has to be divided among hundreds of types of cancers, each of which has a different subtype, different outcomes. And when you try to do clinical trials and you try to figure out the best treatments for children with cancer, you're talking about often like studies with an N of 9. There are no good treatments for some forms of cancer for kids. And I think the world just needs to know that we're using adult treatments. There have been maybe 3 or 4 therapies developed for cancer, but they haven't been child specific. The fact that people like myself, before I was affected by it, never actually paid attention to pediatric cancer, because of course it happens to other people, but not you. I remember that part of myself, and so I understand why people don't think of it, but it's important for people to know that we really are failing our children. It's the number one cause of death in children, aside from accidents. And it doesn't have to be. So I appreciate the opportunity to kind of just mention that on your podcast.
Oh, indeed. It's something I've seen with the increase in cancer-related deaths over time, and it's really alarming. And you're right, children should grow to be adults and outlive their parents. And anything we can do to amplify that voice. I'm really shocked about the 4% of that budget with everything that's happening with cancer. So hopefully more can be done, and we'll continue advocating for that. And as much as you do clinical psychology work, you're pretty much in public health, and I'm sure you do agree that your work relates so much or is intertwined a lot with public health. And I just want to say thank you so much for coming on the show today. And there was so much we could have talked about, but we're limited by time. And so we'll have to do a part 2 to sort of, so be able to elaborate further on psychological trauma. And maybe the next one will be, what can we do about it? And how can people improve their lives and live optimal lives? So thanks to the viewers and the listeners. And this podcast is on any of the platforms you listen to. And we shall see you in the next episode. So thank you so much, Dr. Bianco, and I will be calling on you again soon.
Thank you so much. I appreciate it.